Hello, this is Sean Fraser and Gary Clark from Pinnacle Health Informatics. And today I've got Gary Clark with us on this screencast, and he is the architect of the Pinnacle OLAP analysis cubes. And we wanted to chat with Gary a little bit about the differences between the Pinnacle cubes and why we have them and why we've separated the functionality out as we have. So Gary, maybe you could tell us a little bit about the differences between the cubes that we see here up on our screen. We have the appointment cube, the financial cube, client cube, and services cube.
Okay, Sean, I'd be happy to do that. Well, as you might imagine, as we have the appointment cube here, guess what? It contains appointments. What we mean by that is it's granular to the appointment level. So for a record to exist in the appointment cube, there must be an appointment attached to it. Now, that can be a provider appointment, it can be a provider hold, it could be a client appointment, whatever that may be, but there must be an appointment. So if we have clients that have never had an appointment, for example, they will not be in the appointment cube. If we have providers that have never had an appointment assigned to them, they will not be in the appointment queue as well.
Excellent, excellent. So this would contain information for an analysis of appointment patterns, no-show rates, things like that. Is that correct?
Exactly, exactly. And that's its primary use. It's been used successfully by a lot of agencies, to build out KPI dashboards, analyzing exactly those things, analyzing the appointment utilization, if you will. We can look at what time of the day appointments are being generated by providers. We could take a look at appointment status, things like that. These are all part of that. So if an appointment was canceled, we have a record of that. If the appointment was a no-show, we know that. But again, there will be no records in here concerning, as you can see, we have a number of dimensions, for example, where we have clients, client plan services, cost centers, episodes. None of those items will exist if they are not in some way attached to the appointment. So this is kind of the way all the cubes are designed. They're all designed to be granular, which is a fancy way of saying they're the most unique piece that we can go to, the finest resolution, if you will, that we can go down to. In this case, is an appointment. And with the financial cube, for example, in that case, we're looking at financial transactions. I'd like
So,
to switch over there. I'm sorry, go
so,
ahead.
on the appointment cube, for example, are there any caveats to an agency as far as how they do appointment recording that would make the appointment cube more accurate or more efficient?
Not really. If you're using the appointment system within Profiler, in whatever fashion you choose to do so, the data will come over. If you want to get the most data out of your system, then when making appointments, you should include the most data. And so we should assign a cost center to them, for example, or a program code, things like that, to ensure that when we do the analysis, we can look at it by programs or by providers or by clients. So, uh, you know, without overburdening your support staff, encourage them, or if you choose to do so, you can force those fields in security and profiler that they have to be filled out for an appointment. And these things will give you more data to work with as you analyze your appointments in the system.
What would be a misuse of the appointment cube?
I'm sorry, what was that again?
So, what would be an inappropriate use of the appointment cube?
If, for example, if we were to try to analyze client demographics in the appointment cube, and we're simply and we're not interested in appointments in any way, rather we want to do unduplicated client counts based on client ethnicity, for example, we're going to miss a lot of clients because we have clients in our system that may have never had an appointment. They may have been emergency only. They may be clients that we've just recently added, but they haven't come in for a service, so we haven't set up any sort of an appointment scheduling program for them. So these sorts of things are the type of analysis that you don't want to do from there. In that case, you would go to the client cube. The client cube is going to give you the most accurate record of that because it doesn't require that an appointment or a service have taken place. So if we wanted to look at client demographics, we would go to the client cube. Now, that said, if we want to look at demographics based on on appointments, in other words, we're comparing appointments with demographics. Say we could look at employment status uh, across the from appointment status. In that case, that would be valid because what we're trying to see is there a particular employment status person, unemployed, employed, homeless, whatever that may be, that is more likely to no-show than others. So that would be a valid use of it. But again, we're relating back to the appointment in that case. So anytime we want to look at appointments, we go to the appointment cube. That's the appropriate place to do that.
Excellent, excellent. So the next one we want to talk about is the financial cube. And what can you tell us about that?
Well, the financial cube, as it sounds, is relating to dollars. And within Profiler, those are all located in a table called the revenue line detail. And so you can see we have a revenue line detail measure group here. And it has some calculated fields in addition to the ones that are normally found in Profiler. Again, this would not be the perfect cube to be studying client demographics. We could look at revenue by client demographics, but if we're just trying to do a report to show what the number of clients of a particular race or ethnicity or marital status may be, this wouldn't be the spot for it because it depends on transactions or at least billing signing of services within the system. It is granular to the transaction level, so every adjustment, every transfer, every revenue generation, every payment that is received is in the financial cube. But let's again be clear, it requires a financial transaction, but it doesn't require anything else. It doesn't even require a client. So for example, that we have agencies that do a large number of transactions which are unrelated to services. They take in grant payments, things like that, that are not related to any particular service, and they're not adjudicated to services. So in those cases, we can look at that detail and still see it, even though it's never had a service applied to it. It may be unrelated to clients. Not every agency works that way. Many of our agencies, on the other hand, will not have a transaction in the system unless a service has been generated. But with the financial cube, even though the service has been generated, until it's billing signed, it will not appear in the cube. So this is not the place to be looking at, for example, services, in examining services versus ethnicity, for example, because it's dependent upon a transaction occurring or a billing signing occurring within the financial system of Profiler.
Excellent, excellent. Next up is the client cube. And how is that different?
The client cube is unique in that, again, as we talk about our granularity or the uniqueness of the data, is at the client level. Now, what that means is the only requirement to be in the client cube is that a client has been entered into the system. We don't need to put them in an agency. They don't have to be in an episode. They don't have to be admitted to an episode. They don't have to be in a particular program. That client will show up in our system in the client cube. Remember, this is not that we can't even begin to look at services or appointments because they don't even exist in this cube. We can't look at financial measures. We can look at eligibility, for example, though. Clients have, if they have had a payer data entered, so that they have some eligibility pieces in there, we can examine the client pairs. Um, we can we can look at the diagnoses that have been assigned to those clients. We can look at planned services. It's not necessary that the client have any planned services, but if they do, and we can form those links, then we can analyze the data. But always know that, again, if it's a client cube, our granularity level is the client. And so if we're doing, say, annual board reports where we want to show um, the clients that were admitted into our system, for example, the client cube is where I would go to handle that problem.
So if I wanted to look at encounters in the client cube, why would that be a bad idea?
Well, they don't exist, would be the first reason. There are no services. An encounter is built around services. An encounter is a recorded service. That's just sort of a metaphor for the synonym for the two. That it means that someone met with a client or performed a service on behalf of a client. And since that is a service level item, it's not in the client queue.
Excellent, excellent. And that brings us to our most comprehensive cube, the services cube. And what can we say about this one?
Well, it absolutely is the most comprehensive cube we built, and one of the most comprehensive cubes I've ever seen. And it needs to be that way because almost all of the analysis that we do in the behavioral health industry is based around services. When we do our annual board report, they are generally done around who did we provide services to in the past year. As we analyze programs, it's based on which services were provided. Well, what are our providers doing? What are the services they're providing? If we want to do a productivity report, for example, we need to get into this cube because we need that provider time, that provider duration that's available. But again, it is granular to the service level. So we have to always be careful when we're asking the question to understand, truly understand the question. In most cases and in most states, the definition of a client is a person that has received at least one or more services. Until that time, they are a potential client, just because we put them in the system. However, if that were the case everywhere, then we would never do anything beyond our services cube. We wouldn't need to go to the client cube, for example. But in many areas, we want to look at admissions, and we may want to look at admissions and why and the number of people that never came back after being admitted into our system. And so in that case, we need the client cube because we need to be able to see those clients. So if we have um, clients that we want to look at that have received services, then we're going to go to the services cube. It's granular to the recorded service level, provider activity, co-provider activity, and co-provider service. Those are all in here. And but again, it requires that a service be in place. There is financial data in here, but again, only as it relates to the recorded service. We can't have financial data if there's no service there. We have no clients unless they've received a service. So these things are all, every cube has been built to a particular granularity level. And so we always look at that within our report, and we look at the focus of the report. Is the report based on financial data? Are we looking for payer mix information, for example? If we're doing an AR report, an aging, for example, we would obviously do that from the financial cube. If we want to do a report to see the productivity of our providers, we're going to go to the services cube because we want to see that in relationship to the services that they've provided. So when choosing a cube to write your report out of, it's critical that you really understand the question you're asking, and if we're and the granularity level, so that you can choose the correct cube when the time comes to do your report.
Okay. Well, that's excellent, Gary. We sure appreciate you taking a few minutes to kind of walk us through that. We do have other cubes, but these are kind of the stalwarts of our system, wouldn't you say?
Absolutely. I think you would even say that probably 90% of the reporting that that goes on is going to be out of the services cube alone. Um, with the remaining three there covering most of that other 10%. But so that's why it's the most comprehensive, because most of our reporting is done around services.
Very good. Now, do you have a favorite cube?
Not really. I use the cube I need at the time.
Very good. Very good. Well, we'd like to thank you, Gary, for taking a few minutes to go over that
No
with
problem.
us. And we hope everyone's enjoyed this screencast. And this is Gary Clark and Sean Fraser from Pinnacle Health Informatics. Thank you very much.
Thank you.